the whole issue of vitamin B12 absorption. That patients with pernicious anemia, the idea there is that the body doesn't make intrinsic factor and that the vitamin B12 in the diet can't be absorbed and they get deficient in it. And so if you can't absorb it, then the way you get it is you get a shot of B12. And I think that people, the public knows for many years people were given shots of B12 for energy or shots of B12 to help this or that. It all came from the idea that patients who are anemic because they didn't have enough B12, because B12 is so important in red blood cell formation, those patients who were anemic, if they got a shot of B12, they'd suddenly get all this energy. So the teaching always was, if you can't absorb it, you got to give it by injection. Well, back in the 1960s, so that's 60 years ago, 65 years ago, studies were done that showed that if you give enough oral B12, it's well absorbed and patients can normalize their B12 levels so they don't need B12 shots. But that's an example of knowledge changed from initially feeling we had to give shots to realizing that people can absorb oral B12 and it's been proven, but it still hasn't become the standard of care.